Hello, my name is Dr. Daulton Jr. and I want to welcome you to this video. Today we're going to be talking about bulging disc treatments, and more specifically we're going to be discussing 3 things you can do at home to relieve your bulging disc pain fast and with little or no money. So let's go ahead and just get right into the information here. The first thing that I would recommend that you do is to use ice. Now ice is the fastest way to pain relief, and you want to always and only use ice if you're experiencing pain. Now when I describe pain, basically what I'm talking about is either a sharp type of a pain, a burning sensation, stabbing, throbbing, and those types of pains. Now with ice, consistency is the key. You can't do this once and expect the pain to go away, because that's not the way it's going to work. And I'm going to be giving you some specific instructions in just a couple minutes that you'll want to follow in order to get the best results from this. But before we go into that, let's talk about why you would want to use ice and not heat, because believe it or not, this is really something that gets confused a lot of times. And if you use heat in this situation, usually it's going to make the problem worse rather than making it better. Now the reason that we want to recommend that you use ice is because of a process called inflammation. And let me just show you a picture here of what I'm talking about. If we look at this picture on the left, what we're looking at is a bulging disc. Now what we have here is we have 2 bones of your spine that are stacked on top of each other, and in between them is where the disc is located. Now the discs of your spine are basically cushions that protect these bones from touching each other, and the way that they're put together is they have a strong outer covering and then a jelly in the center. When a person has a bulging disc, the disc will become injured, and usually it's at the back of the disc. That jelly will start to push into the area where the disc is weakest, and it will create a bulge. Now if we take a look at this picture from the top down, which is what we're looking at over here on the right, what you can see here is that this structure is the disc that I'm encircling. You can see the strong outer covering, which we call the annulus fibrosus, and then you've got this jelly in the center, which is called the nucleus pulposus. And if you look over here to the right, you can see that this is where this disc has been damaged, and now you can see that the nucleus is starting to push into that area and is creating this bulge. Now the reason that this problem can cause so much pain is because usually with the spine, directly behind where these discs are bulging, you'll see that the spinal nerves are exiting your spine. The spinal nerves are really important because they control everything inside of your body, and they're very sensitive to this type of pressure. So if they have this pressure from the disc bulging against it, you're going to develop symptoms, and depending on where these nerves go to that are affected, that will determine the types of symptoms that you're going to have. Now whenever your body has an injury like this, what it's going to do is it's going to try to fix it. And the most common way the body will do that is by rushing blood to this area, because blood is what contains oxygen and nutrients for proper healing. However, there's a problem in this type of a situation because this nerve already doesn't have a lot of room to exit your spine and go out to your body. Plus, in this case, you've got the bulging disc, which is causing even less room for this nerve to move. So if you send a lot of blood to it, the area is going to swell up, it's going to get really hot, and it's going to put even more pressure on this nerve, and now you've got a really inflamed and aggravated situation. Now think about this with me for a minute. If this nerve is already hot and inflamed and aggravated, what do you think is going to happen if you put heat on this? You're correct. If you put heat on this, you're just going to draw more blood to the area, it's going to swell up more, and it's going to become more inflamed and irritated, and you're going to be in worse shape. So this is the reason that we want to use ice, because ice will not only numb the nerve, but it's also going to reduce that swelling and stop the blood from flowing to the area so that you don't feel as much pain. Now, here are the rules that you want to follow when you're going to be using ice. The first thing is you want to apply the ice directly to your skin. Now I want to say something about this here, because some people are more sensitive to ice, and some people can actually have a condition called an ice allergy. So what you want to do is use the ice on the skin if you can, but if you're too sensitive for it, or if you start to notice the skin changing in color and like becoming a red color, then you want to go ahead and put a towel between the skin and the ice pack. But try to use it directly on the skin, because these nerves are actually very deep within the spine, and you want to make sure that the ice can penetrate deep enough to give the desired result that we're looking for. The next rule is that you want to use real ice or an insulated ice pack, and this is really important because real ice especially will maintain the same temperature throughout the entire treatment. Most ice packs cannot do that, so you want to use real ice if possible. You're going to leave the ice pack on for 15 minutes maximum, or until you feel numbness, whichever comes first. You want to then repeat the ice every single hour for the best results, and that's what I'm talking about when I say that you have to be consistent with this treatment. If you do the ice treatment every hour for a couple days, usually that's enough to calm it down quite a bit and to give you some good relief. Now, where do you want to use the ice? You want to use the ice over the affected disc and also over any painful areas. Because the nerves are being affected with this type of a condition, the pain will tend to travel sometimes. So for example, if I have a bulging disc in my lower back, it's really common for me to develop symptoms in my leg. So you might get a burning sensation or pain shooting down the leg. So you can use the ice over the leg as well wherever you're feeling the pain, but make sure that you're also treating right on top of the disc, because that's the source of the problem and you don't want to miss that area. One more thing I want to say about ice before I get into the second thing. There is only one exception to the rule of always using ice, and what that exception is if you have a condition called degenerative disc disease. If you have that, sometimes the ice will actually irritate it more. So what I recommend in that type of case is this. Start with the ice. Do it for 3 or 4 treatments and see how you feel. If you feel better, then stick with the ice. But if you're not noticing any difference at all, or if you're noticing that it's even feeling a little bit worse, then what you want to do is discontinue the ice and try dry heat instead. Now, an example of dry heat would just be an electric heating pad that you can buy at any drugstore. But if you end up using the heat, you want to follow these same rules. You want to leave it on for 15 minutes, wait an hour, and then repeat the treatment again every hour. Alright, so it's the same rules, you're just going to be using heat instead. But like I said, that's only in a situation where you have degenerative disc disease that could be causing the pain rather than the bulging disc itself. But try the ice first, because in most cases, the ice is going to be the one that benefits you the most. The second tip we'll talk about is being aware of your sleeping position. Most healing actually occurs while you're sleeping, so it's really important that you're getting a good night's rest every night for this to happen. Now we'll talk about the lower back first if you have a lower back problem. There's 2 positions that will usually help alleviate the pain from a bulging disc in the lower back. The first one is to lay on your back with 1 or 2 pillows under the knees just to elevate the legs. This removes the pressure from the lower back and it's going to help you get more comfortable while you sleep. If that's not comfortable for you, the next thing I would recommend that you try is laying on your side with a pillow between your knees. This opens up the pelvis, which also removes the pressure on the lower back, which should help you sleep quite a bit also. Now, if your problem is in the upper back or in your neck area, then we want to talk about the pillow that you're using. It's really important with the pillow that you use that it leaves your head in a neutral position. And here's what I mean by that. When you lay on your back on your pillow, what you should be able to do is to draw an imaginary line through your ear, the top of your shoulder, and your hip. That should be a straight line if your neck is in a neutral position. If we're looking at you from the side, laying down, what we should be able to do is draw a line through your nose, the center of your chin, and then between your knees. And that should be a straight line. I recommend the Tempur-Pedic pillows. I really like these, but the key isn't necessarily the exact type of pillow that you're using. It's more, how does it support your neck, and can you draw that imaginary line to make sure that you're in a proper sleeping position. The third thing that we'll talk about in this short video is bouncing on a therapy ball. Now, this is going to sound really strange to most people, but I'm going to go and explain why you want to do this, and I'll talk about how we do this. This step should only be started after you begin to experience relief from the previous steps that we just talked about. And essentially what you're going to do is you want to purchase one of these large therapy balls, and you're going to sit on it, and then basically what you're going to do is keep your arms to your side, make sure your head is looking straight forward, and then just gently bounce up and down. Now you're bouncing so gently that you're not coming off the ball, so it's just a really gentle bounce up and down. You want to do this 5 minutes each day. Now, why are we going to do this? Well, the reason we're doing this is because of a process in the body called imbibition. And if we go over here to the pictures on the right, I'm going to explain what that means. Remember these images that we looked at earlier? Well, this is what a healthy disc looks like. So you can see that the disc here is intact, and you can see the jelly in the center. One thing that's interesting about spinal disc conditions is that they're really, really difficult to heal. And the reason is because unlike most parts of the body, the discs themselves do not get a good blood supply. So there isn't as much oxygen and nutrients flowing to them for proper healing if they get injured. However, the disc is designed to basically deal with that, and the way that it does that is that the disc itself will actually store oxygen and nutrients within the jelly center of the disc. The only way that you can refresh this oxygen and nutrients that's within the center of the disc is by using it, basically. You have to gently pump it up and down. So what this exercise is doing is it's gently pumping every single disc in your spine. And it doesn't matter if the problem is in the neck, the upper back, or in the lower back. It doesn't matter, because every single disc is going to be pumped with this exercise that you'll be doing. And it usually makes a huge difference for people, because once you start to get fresh oxygen and nutrients within the disc, now it's going to start to heal a little bit more quickly. So these are 3 things that you can do from home. They're very easy. They don't cost you anything. If you'd like more information, or if you found that information helpful and you'd like to learn more, I do offer a complete program at my website, which includes a book that I wrote, as well as the ability to contact me via email with any questions that you have. I even have some of my customers and patients who will have me read MRI reports for them, just to see if I can make any specific recommendations in those cases. And all of that is included in the program that I offer. And if you're interested in learning more about that, you can just go to the website that's listed here at the bottom of the video. And also, there should be a link in the description of this video where you can click on that and go directly to the page to learn more. Alright, thank you very much for taking this time to go through this video with me, and I hope you found it useful.